Hi, welcome. Let's talk about the tasks that RNs, registered nurses, can and cannot do. If you like my content, kindly support us by clicking on the subscription button. It's free. You can also like and share the video. Let's get to it. RNs work under and report to healthcare providers. That's the doctors, nurse practitioners, physician assistants. RNs can delegate to other RNs, LPNs, and CNAs. RNs can perform the nursing process. They can assess and interpret data, come up with a nursing diagnosis, interventions, and evaluate if the goals were met. It's the RN's job to build a patient care plan. RNs can be assigned stable or unstable patients. I have a disclaimer for this. As long as the question states that the nurse they are delegating to has enough training or orientation related to the task in question, then they can delegate. If not, it's a no-no. RNs can perform any type of teaching apart from that one the providers have to give before a procedure, which we call obtaining consent. RNs can only witness consent. It's the provider's scope to obtain consent. Witnessing consent means that the nurse ascertains, confirms that the patient was educated by the provider about the procedure and all the risks and benefits associated with that procedure, and that the patient has the capacity to give consent. That is, they are not coerced, they're not under the influence of a drug or medication during the time the provider obtained consent. For example, if the patient had just received a dose of Dilaudid, morphine, or some sort of medication with sedation side effects, like benzodiazepines, the likes of diazepam, clonazepam, the patient does not have a decline in mentation. The nurse should also ascertain that the patient is not a minor, or if the patient is a minor, it has to be an emancipated minor at the time of obtaining consent. That means if the doctor had just obtained consent, they walk out, then you walk in, and your patient tells you to clarify anything about the procedure, you call the provider to come back and talk to the patient. If you explain the procedure, side effects, or benefits to the patient, then at that moment, you will be literally practicing medicine, which is not under the scope of practice, or we as RNs are not licensed to obtain consent. RNs can also give all kinds of meds within their scope of practice and training, including blood and blood products, high-risk medications. I call them the pinch meds. RNs can assist providers with invasive bedside procedures. RNs can perform the 2RN checks and administer high alert medication. RNs can also receive written and verbal orders from providers and report to them as well. Let's talk about what RNs cannot do. As an RN, avoid answer options that tell you to delegate a patient who is unstable. For example, a patient who just had a change in status, has a new onset of something, first time doing anything. The only time you delegate such an unstable patient is when there is an answer choice to delegate to an equally experienced RN or higher. And even so, remember the 5 rights of delegation. You must supervise and follow through to make sure whatever you delegate was done and done correctly. You have to keep your eyes on these patients. Your license depends on it. I cannot emphasize enough. RNs do not obtain consent. We only witness consent. I promise you will see that somewhere, either in nursing school exam or NCLEX. But no, now you know it. RNs do not diagnose patients. We can have nursing diagnosis which is different from an official medical diagnosis. I have an example. For a nursing diagnosis, we say this patient is at risk for DVT as evident by immobility and a recent trauma from a motor vehicle accident. But we cannot give official diagnosis of a DVT, or let's say he's saying that this patient has had failure or this patient has a DVT. We only say this patient is at risk of XYZ and as evidenced by ABCD. RNs do not practice medicine. That is, we do not issue medical orders or perform tasks not within our scope of practice. Thank you for listening and supporting this channel. If you have not, please click that button of subscription. It's free, literally. Thank you for those who have done so. And look out for more content coming up. See you on the next one. Bye.